let it come. Whatever stays, let it stay. Whatever goes, let it go. Good evening, everyone. With great joy and immense pleasure, I extend my warm welcome to all the dignitaries, guests, and delegates present here for Dr. Sudhir Raj N Memorial Free Webinar Series organized by DIKSHA E-Learning in association with Ayurveda College Coimbatore under the banner of Azadi Ka Amrit Mahotsav. In today's session, we will be discussing about cardiac rehabilitation through Ayurvedic diet by Dr. Kamlesh Shivaram Mahajan. Before starting this session, I'd like to go through a few of the basic instructions to be followed throughout the session. For uninterrupted class session, use laptop with high-speed internet connection. Please make sure your microphone is on mute to have a disturbances-free session. In case of any disruption, please check your internet connection firstly, and if the problem is within our network connection, kindly raise the issue in the chat box. Filling your full name to be displayed is appreciated. Any question can be raised, posted in the chat box. Questions raised will be clear at the end of the session. Next, I would like to invite Dr. Ankush G, Assistant Professor, Department of Swasthavrita, Ayurveda College Coimbatore, to deliver the welcome address.
Thank you. Am I audible?
Yes, sir, you're audible, sir.
Okay, thank you. Good evening to all. It's my pleasure to welcome you all to Dr. N. Sudhiraj Memorial Webinar Series conducted by Ayurveda College Coimbatore, powered by the DIKSHA platform. And I would like to extend my special welcome to our guest of honor, Dr. Kamlesh Shivaram Mahajan, sir, Assistant Professor in the Department of Swasthavrita, Ayurveda Mahavidyalaya, Nashik, uh, to present on the topic cardiac rehabilitation through Ayurvedic diets. And I would also like to extend my welcome to all the participants who are connected with our platform here in this auspicious, beautiful evening. I welcome you all to our webinar series. Thank you.
Thank you, sir. It's a great pleasure for me to introduce our guest speaker, Dr. Kamlesh Shivaram Mahajan. Sir is currently working as Assistant Professor in the Department of Swasthavrita at ASS Government Aided Ayurvedic College, Nasik. He was awarded National Ayurveda Best Teacher in Swasthavrita at Pune. He has published various articles in national and international journals. He also published various local health articles in newspapers and magazines. Sir was invited as a resource person in state, national, and international level seminars to deliver speeches on different topics of Ayurveda. He completed MUHS Milan project at tribal areas of Palghar on health issues. He recently formulated school health charts for Government of Maharashtra Ayush Health Mission. Sir has successfully conducted various social activities through NSS Program Officer. We're extremely privileged to have you here in this platform, sir. Now, without any further ado, we will turn the time over to respected Dr. Kamlesh Shivaram Mahajan, sir, to enlighten our minds with his knowledge. Over to you, sir.
Thank you, madam. Thank you, Vidya, madam. Thank you, Ankush, sir, for a warm welcome. I would like to share my screen.
Sure, sir.
If it is visible.
Yes, sir. Sir, can you share it in the full screen mode?
Okay, I will try. So it's my honest pleasure. I would like to first thank Dr. Lakshmi madam and the organizing secretary of my college and Shivaram for giving my this
Excuse me,
opportunity.
sir. Sorry to interrupt. So your voice is breaking, sir.
Okay, is it audible now? Okay.
Yeah, now it's better, sir.
Okay. So it's my honest pleasure. First, I would like to thank Dr. Lakshmi madam and also the organizing secretary of Ayurveda College going to DIKSHA E-Learning on the behalf of the Dr. Sudhir Raj Memorial Webinar Series. given opportunities for me to express my thoughts on the topic cardiac rehabilitation through Ayurveda. So we all are quite familiar with the Guru Shishya Parampara, no doubt. Traditional Ayurvedic science and the Guru Shishya Parampara. Vishwa Prakashakam Dhamma, Dhamma Prakashakam Guru, Devarpana Nasti, Tasma Sri Guru Namaha. So I would like to thank all the Lutatray, Nagutray, Tarasisma, Varakata, Bhav Prakash, Lokatna, Sharila, Sanita, Madhonita, who are expressed and given a very deep direction. Enlighten the science, Shastram, Jyoti, Prakash, Artha, Darshanam, Buddhi, Atma. So what is the present scenario? Almost our topic is related with cardiac related
Excuse me,
disorders.
sir.
Yes, madam.
Sir, your voice is not so clear, sir.
Okay. Is it clear now?
Now it's better, sir.
Okay, okay. Thank you. So what is the exactly our science belong with not only the health promotion principles, swasthasya swasthya rakshana, aturasya vikat prashanam. This is the basic principles of Ayurvedic science. So sanksheптः kriya yoga nidan parivarjana. Second one basic principle. Nidan parivarjana. How to avoid the aggravating factor that is responsible for the disease, ill health. So considering the present scenario, non-communicable disease, cardiac disorders, mainly triple vessel disease, various logopathy, mitral stenosis, or related with cardiac myopathy, and CCF, congestive cardiac failure, after surgical procedure, major surgical procedures, or related with heart problems, going treatment. So it's a very difficult to please unmute. So it's very difficult in a present scenario to how to manage not only on the conservative and not treatment surgical point of view, but simultaneously rehabilitation is very important. So according to the Ayurvedic point of view, what is the strength, weakness, opportunities, and threat? That is a SWOT analysis. Considering the non-communicable diseases in the silent killer form like diabetes mellitus, hypertension, cardiac disorders, or rheumatism. So it may be fatal. It will not be in the present time or proper limited time of diagnostic methods. So what is exactly why this is happening nowadays? Due to the modern lifestyle, sedentary lifestyle effects at physical level, mental level. Because if we
Excuse
are
me, sir.
yes,
Sorry to interrupt. Sir,
yes,
can you share the PPT in full screen mode?
okay. Okay.
Yeah, now it's okay, sir.
Okay. So in the present scenario, what is the exactly concept of Uday? Uday in Ayurveda at Mastishka Uday also described and Urastha Uday. Describe Urastha Uday that is situated at we are quite familiar with the thoracic cage or what were the pranavasrotas. Mulasthanam, Mulamiti Prabhavasthanam, what are mentioned by Sushruta. Pranavasrotosa Uday Mulam Mahasrotacha and Rasavana Srotosa Uday Dashagamya. So considering the Uday at Urastha Uday, Trika and Mastishka Uday, that is a thought process, positive, destructive, constructive thought process, destructive thought process, what were going in the mind, Atma, Manasa, Sayujate, Mana, Indriya, Na Indriya, Artha, Mutananam. So this is also responsible for the ill health of the heart. So not considering the Rasnatmak point of view, but Kriyatmak point of view, and also the circulating point of view, means we have to focus on the Rasnatmak point of view, Kriyatmak point of view, and circulatory point of view when we are considering the heart problems or heart related diseases or heart related complications. So at physical level, sedentary lifestyle effect, non-communicable diseases, hypertension, diabetes, obesity, that result into hyperlipidemia, dyslipidemia. After that, if we will not control with proper dietetic remedies, it converts into atherosclerosis and after that, high hyperlipidemia, it causes single vessel, double vessel, or triple vessel disease. And after that, angiography, angioplasty, or bypass advice. And after that, surgical procedure, we have to take long-term medications. Long-term medications causes various types of side effects on the body also, at physical, mental, social, economical, financial level. So, रसवाहिनी दुष्यंती चिंतना प्रतिचिंतना. So this is a basic etiological factor. रसवाहिनी दुष्यंती चिंतना अतिचिंतना. And Upadhatu of Rakta, that is Asruj, is Kandarasira. So it is related with the vessel. All the diseases which are related with the heart is almost 90% is vessel related, or you can say artery related diseases. So acid peptic disorder also common nowadays. Allergic conditions, endocrine disorder, hormonal disorders, at mental level, depression, anxiety, psychosomatic disorders that affect physical, mastishtha hruday vikruti also, and purastha hruday vikruti also. So what we can see is restlessness, insomnia, sleeplessness, and insecure feeling loneliness in present scenario. So what to do? Then it is a very important. This is a picture World Salt Awareness now 14 to 21 this week by ICMR guidelines, NCDIR, average salt consumption. So we have to focus the etiological factor that are responsible for the ill health of the hriday or cardiac point of view. So basic is one of the is a has salt restricted diet, no doubt at all. But in Ayurveda, Sendolon is a Pathakaranam system, that is a Launam Kapha Michandati. Kapha Vichandati. So what is the Srotolekhan? Because this is a Srotomay Purusha. Our Charak Vimanstan, 5th chapter, given a very nice explanation of Srotas. So concept of Srotasa, Yavanta Loke Murtamanta Bhavis Tavanta Purusha, Yavanta Purusha, Tavanta Loke. So Srotomay Purusha, and this is the Akashvayu Mahabhut Pradhan channels. So they are conducting the Prana Shonitahi Anuvartate, Rakta Jiva Niti Sthiti. Prana means what? It is nothing but the oxygen carrying what were the required for heart pumping actions in the form of Prinanam, Lepanam, Jivanam, Prinanam, Jivanam, Lepaha, Sneho Dharana Purne. Because in the Kriyatmak point of view, Hruday, Avalambak Kap, Sadak Pitta, and Vanavayu, these are the major responsible factor for health of the heart and also the ill health of the heart. So nourishment of this dosha dhatu and in the form of Mausasya mala, whatever it may be, or Rasopishlesh mala vichar, we have to nourish the dosha, the Avalambak Kap, Sadak Pitta, and also the Vyanavayu. And simultaneously, we have to focus on the point of view, dietetic point of view, as well as water intake methods that is responsible because Rakta have Dravatva property. So increased guna of Dravatva that causes in Vikrut Avastha that causes Vikaro Dhatu Vaishyaman that causes a Dravatva and that affects the arterial wall of the heart. So we can see this is the angiography one of the patients and this is a triple vessel disease advised patient bypass surgery. And this is a stress factor nowadays. So just I have seen Rasavayani Dushyanti Chintana Prati Chintana stress level factor. So Ayurvedic diet is not only related with the food or water, it is related with also the mental nutrition. Mind nutrition is very important when you are considering the cardiac management or rehabilitation because Satvaja Chikitsa, Jala Ashwasan Karanam system, like that, Ashwasan Karanam system, proper counseling, not only medication, not only the exercise, not only the yogic practice, but spiritual, your nutrition, spiritual diet is also important when we are considering because we can't avoid the thought process. And in present scenario, Prajna Aprat, I will show you next slide. And this is our today's culture that is a various types of fast food consumption methods, wrong consumption of foods methods that also causes or responsible for the heart diseases. So coronary arteries that supply oxygen and blood to the heart become narrow. Heart wall, one or more of the wall in the heart are not working well. Congenital heart disease, children may be this disease. Arrhythmia, abnormal heart rhythm, heart failure, heart does not have enough strength to pump, and heart muscle pathology, heart wall become thick or heart become enlarged. So this is the types of heart disease. So what is required is keep balanced diet, keep yoga, meditation, keep regular exercise. This is generally recommended. Or you can do exercise, lot of exercise, but how much exercise? Ardhashakta Vayam Pariksha. So lot of excessive exercise that also causes harmful effects on the physiological action of the heart. So diet, I will next slide I will show the equilibrium is important. Means what is the equilibrium? Because itself human is the victim of environment. So external equilibrium, internal equilibrium, seasons, biological clock, day night,
Excuse me,
our
sir.
routine. Yes,
Sorry to interrupt.
yes,
Sir, can you keep the mic closer? Your
yes,
voice
yes,
is
yes.
not so clear, sir.
Okay, okay, I will try now. Is it okay?
It's better, sir. Yes,
Okay,
sir.
thank you. Sorry for trouble. Prakriti also important, age factor, and dietetic seasonal code and conduct regimen that affects environment to human body because annat purusha. This is mentioned in Paitanya Upanishad. आकाशात वायू वायू तेजस तेजसात उदका उदकात पृथ्वी पृथ्वीच्या औषधात अन्न and अन्नात पुरुष. So human body is made up of food, various types of food. That is a constructive, destructive, sattvic, rajasic, tamasic. What were mentioned in our ancient literature. That is a very divine science and not and it is a evidence based nowadays, specifically in pandemic period. So this is one of the very good shlokas mentioned in Vagbata. Kalartha karmana yoga hina mithyati matrakaha samyak yogache vidnaya roga hridaya karanam. So this is a common basic principle of any disease conditions, whether it is communicable or non-communicable. And in Bhagavad Gita, it is a dialogue between Sri Krishna Bhagwan and Arjuna. Chanchali Mana Krishna related with mind. So, how much quantity mind is involved in various types of cardiac disorder? So, we have to focus the mind nutrition, mind health that affects simultaneously at physical level. So, Chanchali Mana Krishna Pramarthi Balvadudam Tasya Nigraha Anye Vayoyoso Dushkaram Asanshaya Mahabhava Mano Dunigraha Chalam. So mind is not stable. Chanchal, mind have a property. Chanchala, not stable. So naturally, अभ्यासाला तू कोणताही वैराग्याचे दिवते. So what is good, what is bad? This is a generally we have to focus. Dhi dhruti smrti vibransh karma akrutya shubham prajna apradam ta vidnaya sarva dosha prapopana. So we have to focus these five senses, our pancha jnanendriya, कर्मेंद्रिय वाक पानीपात वायु उपस्थ because they are responsible activities, physical activity, psychological activity, psychosomatic activity, and that is responsible for cardiac health as well as cardiac ill health. And this is a important lifestyle because when we are considering the diet, Ayurvedic diet, so we have to focus on the what is the lifestyle of the patient, whether it was suffered from already the cardiac element or what were the means episodes happened in this in their life, but we have to focus their lifestyle, their daily regimen, seasonal regimen, and yearly how he or she conducted activities. So positive yogic and Ayurvedic ancient science and negative Bhogwadi cultural science. So destructive mechanism, that is a cultural science Bhogwadi. So it's a happiness index, destructive thought mechanism, and yogic and Ayurvedic it will follow the lifestyle. It's a new of our nowadays happiness index plus constructive thought mechanism and causes the samadosha, samadnicha, samadhatu malakiya. So simultaneously balancing the doshas at mental, physical, social, spiritual level. So this is a dimension of physical lifestyle. Ajibaicha Batwa, or we can say Dinacharya procedure, where also the natural dharaniya weight, Kama, Krodha, Lobha, Mada, Matsar, that also affect the Hruday, Mastishka Hruday, simultaneously Urastha Hruday. So this is a what is the exactly the parameter that are responsible for the health of the heart and also the health of the heart. Vikaro dhatu vaishamyam samya prakriti uchyate sukha sadnakam arogya vikaro dukkham evacha. So just like our Srotomai Purusha channel else, our heart is made up of various types of vessels, artery, veins, and all are medicals. So don't I am not wasting time on anatomy aspect of heart as well as physiological aspect of heart. But what I want to say Ojasta tejo dhatu nam shukra antanam param smurtam. So when we are considering the heart rejuvenation or heart rehabilitation program, Oj factor is very important. So what is Oja, Para Oja and Apara Oja? That is already mentioned in our Sanhita, but this is the Dhatu Dhatu Ahara. From Rasa Dhatu, Rakta Dhatu Poshan, Rakta Mausa Poshan, Mausa Meda Poshan, Meda Asti Madhya, and Shukra, and after that, Ojastu Tejo Dhatunam Shukrantanam Param Smurtam. So Oja is a very important factor. When we are considering in a circulatory point of view, it is the upper Oja, and when we are considering at Doshasthana Avastha, Srotas Mula Vichar, it is a Para-Oja. So Vikruti of Para-Oja in the form of cardiomyopathy, in the form of obstructive vessel disease, it affects the various types of cardiac complications. So we have to treat that properly, and diet also according to that. Tarkokta Mahakashaya, Jinia, Brunia, what we are mentioned, Dipania, Pachania. So when the Dhatoi Dhatwara, just like in the farm, this water is processed at the end point of the farm through this mechanism. Uh, our body is also channelized by the शब्द अर्चुजल संतानवत what were mentioned Gana Hriday Sita Krishna Dehachari Mahajava. So Anupana Vichar, carrying vehicle, whatever you are taking the food or intake of the food in various quantity, simultaneously what type of liquid form of diet you are taking along with the solid form, it is very important when we are considering the portion of that, because Rasas was Satosa Mulastham is a Hriday. So it requires Sabde Prinamam and also remove the Dhatu Shatilia like Dravya or food, which are Rasadhatu Prinam Karya. So function of the Rasadhatu is Prinanam. So naturally it nourishes the heart. So we require the Anupan that nourishes the Rasadhatu. So Rasadhatu portion naturally affect or after the Shukra Dhatu, it will nourish the Ojadhatu. So Grutam Piktamila Hara Rasa Shukra Ojasa Hitam. What were mentioned in our literature, Ayurveda, Harvard. Gruta, Kaugi, Panchadavya, Kaugi, Gruta, Pitta Nilahara, Rasa Shukra Ojasa Hitam, Nirvapana Mridukara, Swara Varna Prasadanam. So this is very important. So keep in mind the Gruta remedies, keep in mind Panchadeva remedies. I will show in later side. But what is Anupan? It is a carrying vehicle. Anupanam hitam yukta tarpati ashumanam sukha pachaticha ahara ayushecha balayecha. So ayush dirgha dvitam adhyay. Longevity of life through the proper Anupan consideration, Anupan vichar. In this present scenario, we are just taking water. In Ayurveda, water intake method also mentioned in Ahar Vidhi Visheshayatana, in Stavida Vidhi Visheshayana, Ahar Pranamkara Bhava Visheshayana, various types of elements. So, Jala processed with medicinal plants, herbs, that is the meal of our. Not only the plain water, warm water is also considering, but water is processed with like Musta, Nagarmotha, Musta Siddha Jal. If giving to the cardiac patient, definitely it will good. Musta Dipana Pachana, and also it reduce the cholesterol. So Lekhan Karya is also happening, and this is a guideline by Minister of Ayush. I would like to thank Honorable our Minister of Ayush authorities uh, because they have given various types of nowadays in the platform of Facebook, various types of media, very good literature in the form of applied aspect. Spices like haldi, turmeric, jeera, turmeric, dhania, coriander, and lasun, garlic are recommended in cooking. This is the nature and this is the common. Kitchen is the primary pharmacy. No doubt, because Anna Purusha. So nourishment of the our various soft organs, our bone joints, that is totally depend on the our kitchen pharmacy. Spices are the best medicine. It can act as medicine to prevent infection when using right quality and quantity. So quality and quantity is very important. In our hospital, we are daily delivering the all the our employee and also the patient. This is a preparation from this our kitchen remedies. So this is a preparation of now in pandemic period. Ayush was given Sunti Siddha Jal, ginger water also distributed. flow water also distributed. So it have very fantastic and very positive result without any side effect or complications in the form of acid peptic disorders or hyperacidity. Many patients complained after taking consumption of Ayush piles, hemorrhoids, anorexia disorder, bleeding tendency, but in a little quantity or proper quantity under the guidance of Ayurvedic worker, Ayurvedic expert, one can easily maintain our body nourishment through proper liquid, semi-solid, that is a Manda Paya Vilepi Yavagu use. So Manda Paya Vilepi Yavagu is the basic our dietetic principle, no doubt at all, but simultaneously vehicle carrier methods, Anupan form, that is also important. And what is important, how to take, when to take, at what time to take, and what conditions of our biological clock, अजीर्ण भेषजवारी जीर्णवारी बलप्रदम भोजनामध्येच अमृतवारी भोजनांते विषप्रदम. So what we are mentioned in our science, that is a totally evidence based, that have a practical observations example, so we can apply the yukti praman. Yukti praman only mentioned by charkacharya and charkastu chikitsate. So this is one of the shloka mentioned in Bhagavad Gita. Yukta har vyarasta yukta chestasya karmasu yukta swapna vedasya yoga bhavati dukha. So swapna, nidra, sleep pattern is very important when we are considering the cardiac health, when we are considering the nourishment of the heart through diet. So sleep is also diet. This is important. Sleep is a Vihar Chikitsa. It is not a Ahar Chikitsa, but nowadays I can say that sleep is a nourishment point of view of heart, nourishment point of view of brain, nourishment point of view, all the voluntary, involuntary body organism. It is very important. So sleep pattern, and nowadays when we are seeing the last thing, 2:30 a.m., 3:30 a.m., 1:30 a.m. means what? Ratro Jagranat Vata Prakopaha. Sushruta mentioned. So nowadays, due to the sedentary lifestyle habits, one whatever we are not taking proper sleep, 8 hours sleep is not possible due to the various reasons. And Saturday, Sunday, many times we are taking lot of sleep. So totally disturbing pattern, night duties, shifting patterns, employee companies, whatever industrial sector. So where we are considering all these factors, it is very important to focus on the traditional food recipes from Ayush system of medicine, Ayushman Bharat. This is a booklet that is published by our Honorable Ministry of Ayush, Government of India, Honorable Secretary Rajesh Kotecha sir, he also addressed that one. And this is the Ayush system player not for the role in taking care of health of the public. Proper nutrition is a key element of health. Ministry of Ayush is associated with Poshan Abhiyan or National Nutrition Mission, a Government of India flagship program since its inception. There is a broad scope for Ayush intervention to provide proper nutrition to the public. So this is a stepping stone. Now I would like to focus how to maintain the various kalpana or diet, dietetic recipes, dietetic remedies can be give to the patient of cardiac related diseases. So in each and every cardiac hospital or big various surgical procedure they carry actually after procedures after some period one can easily advise these types of kalpana also Shirpak kalpana, Arjun Shirpak, Rason Shirpak, Chandan Shirpak, Sunti Shirpak. So Shirpak kalpana is also good because we know Satya Sutra Payaha and also Junyanam Sreshtam. Shira is in mentioned that it is a light giving. So Shiram Ashta Guna Dravya Shira Pura Chakri Gunam. This is a process how to prepare the Shira Pak Kalpana. And one each and every Ayurvedic worker is quite familiar at second year, third year, and after that also in the Rasashastra, Shira Abheshaka Kalpana. So what to how to prepare and in which quantity, how much quantity we can deliver to the patient in hospital also, in our home environment also, in the morning, at what time, in the evening it required, and at night at what time, according to the Prakriti, according to the Agni Vichar, and according to the body conditions of the patient. Whether it is related with means various types of avastha vichar that is mentioned in our science. So Arjun, the properties of Arjuna, property of Rasom, properties of Shinta, and properties of Chandana, that is quite familiar by the Ayurvedic workers. And this is a golden tool, I think so that Rutu Haripati Rasayan, it is very neglected, but in previous scenario, in our day-to-day routine, like Punarnava, I am addressing patient Punarnava Paratha to the patient related with the sister condition, pelvis to cardiac failure, or on the face, or cochleus on the face, related with kidney nephropathy, renal hypertension. So just how to prepare proper food with medicinal plants or herb संस्कारी गुणांतर्धान. So रुक्तो हरिपति विचार, हरिपति वर्ग, भाव प्रकाश, श्वास class, both are related with the patient suffer with cardiac faults of view, cardiac disease, dyspnea on exertion, palpitations, if known case of hypertension with diabetes, prameha. So this is a various types of condition. In this condition, one can easily apply the Rukti Rasai according to the seasonal code and conduct. So Nidan Parivarjana, as we know, Anna Purusha, simultaneously Achar Rasai, disciplinary code and conduct. If you are taking the medicine only, so be continue with proper follow. If you are not taking follow, then it will side effects of the drug we can't say nor neglect. So proper follow, that is also achar rasayan, code and conduct, disciplinary code and conduct. Uh, Hyperlipidemia, we are familiar with the various types of high sugar level or hyperglycemic index increase by the food. So we have to avoid that specific hyperglycemic index induced food pattern, and method of diet, sleep, water regimen is also code and conduct pattern, or we can say safe disciplinary methods that is required. So in our present scenario, Anupana is important. We are considering the cardiac patients proper water.
Excuse me, sir.
Yes.
Sorry to interrupt. Sir, if you don't mind, can you use the headphones?
Okay, but it's not possible in this present because my voice is not here.
Yes, sir.
Okay, I'm just trying to set up the what happening exactly.
So please hold the mic closer.
Okay,
Okay, sir.
is it okay now?
Yes, sir. Better.
Okay. So warm water is important for the to remove the toxins in the accumulated ama format, because ama there is a doshama. So what were the Rasagapa property that is related with atherosclerosis? Ama is also point of view, atherosclerosis point of view. Warm water or various types of herbal, because Ayushkara or sudden the Pusta Prakata Kishira Chandana Tavachana Agare. So this is a preparation we can easily advise to the patient who are suffering from the hyperlipidemia, obesity, or because that ultimately after some period causes cardiac diseases or heart related diseases. So it is very important, and this is a self-disciplinary methods patients should follow. Abhyagam Acharita. You know what is the, because Vana, Rajapitta Vanavayu, it varies the Vanavayu. Abhyanga ultimately nourishing the Vanavayu, Nityam Abhyangam Acharita. Nasya Vedan medication, Nasa is Iswadvaram, and Prana Satasa Medasthana also Hudai. So Mastishka Hudai. So major meditations, Nasa is Iswadvaram is very important. Pada Abhyanga, and Netra Swasthya, eye health, that is totally related. And when we are facing the problems of eye also, naturally we are facing simultaneously or ultimately or directly, indirectly, it is related with the heart also. So diet management according to the season, physical problems, common healthy remedies of diet, geriatric period, black disease, hyperacidity. Many times cardiac patient complain hyperacidity, severe burning in chest and abdomen. Constipation causes water continuum gati and given heart pressure on the heart also. So Manuka or black resist is very good remedies to release the constipation also and also the property in the form of Vatamumana. Angiorus that is also considered as a Hridaya. So Hridayas or cardiac tonic in the form of Ayurveda that is also easily you can advise in the Chinchapana form, Amartipana form, or Khajur base, liquid diet in the form of appetizer and bone regulator, green vegetable soup, semi-solid diet, nourish the rasa dhatu, cow milk, ojastu, pijo dhatu na, sukraltana, parasmurtan. So cow milk and ghee and mental diet or mental nutrition for the heart is also important and that is in the form of our financial stability planning because many times hurry curries causes heart problems. So mental nourishment, proper our so financial fitness factor, communication and interactions because nowadays we are facing nuclear family problems and also insecure feeling due to the various types of a lot of polluted problems or reaction interactions in the media or whatever we are facing today in the form of pandemic, phobia is there. So that also related with the heart indirectly directly. So yoga nidra relaxation technique for the heart, opening of the heart functioning. Yoga nidra is important. It's a one type of guided meditations. Deep breathing exercise, outing at various holistic meditations. That is also a best nourishment point of view of the heart. So it is very important. Hatha yoga application that is the asana, but how to practice yoga under the expert of yogi therapist because it may be many times hamper the our body function or heart function. So better way one can take proper advice like Shavasana, Makrasana, or whatever easy asanas according to the prakriti, according to the stamina of the patient, according to the sattva vichar of the patient. And just I have last time slides mentioned related with the Anupan vichar. It is very important. Panchagavya, Panchamrut, prepare Panchamrut, brain tonic, heart tonic, and also it contain the honey. So honey properties have low white property. That is a carrier the properties of the other substance which we have mixed with honey. So yoga vahi, karam vahi, soyoga tubhyat, dahatu, tejasalitva, sikatu, solo samsaya. This is one of the sloka mentioned with Lobani. What is the concept of Lobani? So like Anupana, Lobani Anupana is very important and you are giving proper considering keeping mind calculation of the herbal food product or mineral herbal mineral for preparations. So cow ghee, curd, cow. This is a totally product of cow. So it is a panchagavya and it is very good on effective Ayurveda. Also the part of spiritual nutrition, it is very important. Now we can prepare the basic dietary principle of mental rehabilitation in various conditions of the heart maintenance factor that process in abodravas for our heart immunity or immunomodulator, junior mahakasaya dravya, process with manda, process with paya, process with immunity, process with yavaru. जर फक्त 28 types of yavaru, सूर्य नाशक yavaru, dipani yavaru, pachini yavaru, samdrai yavaru. That is also very important and we can focus on that yavaru also. Yusha kalpana, so Yusha kalpana definitely not only sansadan karna after panchkarma, but also mudra use like it is a tridoshama. So what we process with Yukti Praman, application of Yukti Praman in our various conditions related with problems. Brunia Mahakasaya, it is required which condition, Bande Mahakasaya, Rudde Mahakasaya, that is the cardiac tonic. If the patient is suffering from cardiac neuropathy or Bhagwan disease, they require the Balya nourishment Brunia to the cardiac muscle. So which types of dravya we process with Panchavya or ghee or milk or water. So Rudya Mahakasaya, Vishagna Mahakasaya, preparation methods, quantity of the raw material that is also important nowadays. Is it working or not working? Expiry period, it is also important. So how we process the diet, it's instant ready, or it is already just we can say nowadays is a need to form many times they have to consume various types of food. So it is not good for our health also. ಯಾವಾಗೂ ಗ್ರಾಹಿ ಬಲ್ಲ ಕರ್ಕೊಂಡು ವಾತ ಮಾಡ್ತೀವಿ ಸೊ ವಾತ ರಿಲೇಟೆಡ್ ಡಿಸಾರ್ಡರ್ ವಾತ ಫುಡ್ ಸೊ ರಿಕ್ವೈರ್ಡ್ ಬಲ್ಲ ಕರ್ಕೊಂಡು ಯಾವಾಗೂ also required abhinoma because it naturally creates the disease that is well before that is Pratibandha. So aggravating factor that is responsible for cardiac health that naturally create or is by various types of our diet regulations. Guru Chapatarpanam Chestasthularam Karsam Prati Visamam Granathacha Lagu Satarpanam Chaya. So according to the conditions of the heart suffering, heart related disease conditions, obesity patient or not obese but it is a weak or push. So require duha in that conditions. It should be lagu, light, but it is subject to and in the patient suffering from obesity, induced heart disease, guru, but apatarpana because naturally suddenly apatarpana causes dictation of vata. So require sadhyatarpan, but it is in the form of guru, but also karsana. Lekhan how should have the property that proper food. So Deepanya, Balya, Bhunya, Junya, and Udya. This is a considering when we are considering the treating the heart related problems. Biowater Veda. This is my book is coming nowadays now in the upcoming 6 months. In that total processing of various medicinal plants or products with water, Ushnodar, golden water, snow water, ginger water, turmeric water. Just in the foreign countries, turmeric lactate now recommended in various malls also. Like just like our city, like the big bazaar or metro mall. Now even preparation of turmeric lactate, that is turmeric lactate, is easily available in their complex, and it is the best recommended form of nowadays to reduce the problems related with the various non-communicable diseases. Because if the Shreshma Amvata Mitrovna Basti Shodhanam Deepanam, because many times patients require diabetics. So Basti Shodhanam, Mutra Virajnana. So that is also important because Mutra Ledasya. So God have to focus the trailer which are also when you are considering the heart health, play the Shodhan is important because it is nothing but the just like exotoxins, and ammonicity. So what we require dietary form that is Mudya that also acts on the heart. So diet that is processed with just like take the example of Gokru or you can say Unarna, clove or ginger, Ampachan, best remedies we can easily advance. So Yukti Praman is very important. What is I would like to conclude at the last. And this is the importance of Patya Sloka. What is the importance of Patya in the present scenario? Because whatever you are eating, that is naturally paid into our health of the body. So at psychosomatic level, according to the World Health Organization definition, health is a condition of state of complete physical, mental, social, spiritual well-being, and not merely an absence of physical infirmity. So we are taking the grocery, we are taking the vegetables. Now the choice of is where we are taking proper food, medicinal plants or with fat and diet or water the causes related with the cardiac health. So it is totally depend on your prajna, sthita prajna, do or don't do. So this is the condition, and it is totally depend on our mind factor. So Chanchali Maya Krishna, what to do, what not to do, and how it will affect on your body mind. So health conscious is important factor nowadays, but we are not health conscious because we are running along with hereditary mechanism. So that is responsible for the different types of diseases. So considering nothing but telling of Ayurvedic Nutrition Council for research in diabetes nowadays, not only for cardiac rehabilitation but also diabetes, rheumatism, and autoimmune disorders. Code and conduct regarding intake of food and water according to the Ayurveda is only of time, and one have to focus on the Mahakasha because that many times neglected part. Vayasthapan, Purush, Virajniya, Mutra Virajniya, because it is very important. Mala Vichar is important, related with Kama, Soto, the Balabrusha, Varu, Purta mechanism pattern. Ectopathogenics also to Vibhuti. So, Purush Virajniya, Mutra Virajniya, and Vayasthapan, rejuvenation of heart, rejuvenation of lung, rejuvenation of kidney, Rukka, because when you are considering the heart mechanism, heart उत्पत्ति that is शोणित कफ तथा हृदयम शोणित कफ रक्त शोणित रक्त and कफ रसोपि श्लेष्म उपधातु शोणित कफ प्रसाद हृदयम रक्तमेद प्रसादातु रक्त. So विकृति of रक्तमेद naturally causes the accumulation of the lipid or fatty mixed with the vikriti, and that affect the renal hypertension like the raktameda prasadato dukha. So just like that, we have to focus matra karasya yukti, siddhi yukti pratisthita, ishtati par yukti no, dravya nanota sada. Lastly, I would like to thank Dr. Sudhira Memorial Webinar Series Organizing Secretary, Ayurveda College Kanpur, all the teaching, non-teaching staff or technical staff support, specifically DIKSHA E-Learning organizing committee members, and lastly, Dr. Rashmi Madam for coordinating. And I would like to say, live in peace, not in pieces. This is a maybe take-home message. We are quite happier because it is a lot of students also, medical, non-medical, IT workers, research workers, PhD students, MD students may be present here. So I would like to only one sentence, say one sentence, live in peace, not in pieces, because सर्वं देव परित्यज्य शरीरम अनुपालयेत्. Thank you once again. I would like to hand over.
Thank you very much, sir, for taking your time to prepare for us such an extraordinary enlightening session, which was incredibly informative. We will now go ahead to the question and answer session. Shall we begin, sir?
Yes, no problem.
Delegates can post your questions in the chat box. Sir, here is a question, sir.
Yes.
What is the reason for the fluctuation of blood pressure in a point with previous IWMI? Which medicine will be best for hypertension?
According to the, yes, very good question. According to the our prakriti vichar or body avastha conditions or dosha vikruti vichar, because dhatu dhatu I was saying अनुसृष्य समुच्चना चरित्र है. What we mentioned according to the point of the modern science, inferior or myocardial infarction, okay, no problem. What is the past history of the patient? Many times it may be cited, in case of only hypertension, patient taking regularly hypertension medication in the form of beta blocker or other, they are recommended by the physician, cardiac physician, but still patient got MI. So there are a lot of reasons. According to the Ayurvedic point of view, only things or only consider the psychosomatic discharge. That is, we are considering the what is the aggravating factor at that time responsible. So there are a lot of responsible directly, indirectly, because I have already mentioned Purushastra Prakritam Siddhanta. So body equilibrium, external equilibrium and internal equilibrium. So coordination. Because आहार विहाराच्या दोष गुणे समे धातु भी विघ्नच्च अपि स्रोतसास प्रदूषिता. So when patient taking proper diet, still patient got MI. This is I have seen example. Regular exercise, regular every practice. So we can't say this is the specific reason and this happened. And I have already mentioned that Rakta how property Dravatva. Disrata Dravata Raga Sarinam Labhuta Tata. This is the property of Rakta Dhatu. So in that Dravatva of Rakta Dhatu, due to the increased quantity of the Dravatva, it naturally exerted the pressure on the outer wall of the coronary artery. So it increased the hypertension. Also, I have said at mental level, Mastiska we can't neglect that factor because we are very what can I say? Many times patients are narrow minded. They have narrow minded tendency. So they have venous supply, and it is also responsible for blood pressure. Not to expose or express our facts, not to express our feelings. So it is also important when we are thinking expressions, thoughts, laughing pattern, speaking pattern, and not to accumulate in our mind because mind plays very important role in calculation. So not point of view only patient is on case of inferior and minor interaction or various different types of cardiomyopathy, but still proper history making and one should kindly give emphasis that he is your family member. Just treat me or her like your family member. So I would like to say Saraswata we have been done by not only the diet factor, not only the various different types of myopathy or vascular factor responsible for hypertension. Many times not proper dose of medication or skip of medications that also responsible.
Thank you, sir. Here is another question, sir. An Ayurvedic diet for hypertension.
Pardon?
Ayurvedic diet for hypertension.
Okay. See, this is a very important. I have already told that so, for example, take an example of this diabetes or what is the exact factor responsible for the hypertension. So, first we have to rule out at physical level or whether it is at mental level or combined with physical mental level. So Darshan's person and Darshana, this is a diagnostic method, Pariksha, Aspol Pariksha, Nari Mutra Karam Divas. So diet is important, but diet, which types of diet? So this is the pattern. Vatanuloman, Kapha Motion, all of the Kapha Motion, Sadhalakita. So brain related, brain mind nutrition in the form of various spiritual nutrition form or mental nutrition form in the form of beauty practices using the relaxation technique. So it is also Ayurveda diet. This is not only the food. Various types of green vegetable soups, antioxidant diet, vitamin C, citrus fruits, related English antioxidant diet is also good. That is a Budya, Amrasatmadravya, Chintamana, Khajurani, Mantha, or different types of remedies. One can advise the patient suffering from the hypertension.
Thank you, sir. We have other question. Sir, for diabetic mellitus type 2, what medicine we have to give as cardioprotective?
Okay, the patient is one case of diabetes also, and medicine according to means considering the sugar level, BSL, fasting PP, glycosylated hemoglobin, what is the average value of glycosylated hemoglobin, whether it is he or she suffering from diabetic retinopathy, nephropathy, diabetic means various neuritis. So in this patient, generally one can advise according to the Ayurvedic point of view, the anti-hyperglycemic index is important. So shuntas the preparations or inner preparations is important. Musta preparation is very important. Musta nagarmota. So it is also important. Kalpa is available in like you can say Swarna Lakshmi Vilas or whatever you can advise the patient. But I am not related with the recommendation of the medicine any form of, but preparations of herbs with food process that is important. So turmeric, haldi, that is also important. Garlic also important. Various types of preference in the water this process with prefer water that is important. So you can easily address to the patient. Just like Chandraprabha water is also good. Google Shilani preparation. So Shilani Google preparation always good. Arogya water is also good because it is also contain Google and Shilani. And related with Yakruta also. So रक्त व स्वतः असताना रक्त पियाचं सायमल्टेनियसली पोषणात रक्त राहते.
Thank you, sir. Sir, can you suggest a name of books on Ayurvedic diet with respect to cardiac rehabilitation?
I would like to suggest commentaries. Focus on the commentaries, Vigatray, Lagutray, and also the newspaper Ayush now traditional food recipes booklet that is published here. It is very good. They have given various ways of preparations, so one can easily focus on that and easily prepare. So best way to focus on the Buddha and Bhagutta Yogi, Chara Sushruta Vagutta, Madhurita Navagnata, Bhav Prakash, Bharat Basic Ratnakar. How you will Shastram Vitti Prakash Artha Darshan Vitti Ratnakar, already I have said. So focus on the only commentaries, and after that the proprietary in the form of is guided by the anyone. So need of mastership, Ayurvedic mastership is also important. Hotel management courses of Ayurvedic nutrition are important. Very good question.
Thank you, sir. Thank you, sir, for answering all the questions patiently.
I request Dr. Rajalakshmi PR, Associate Professor, Department of Swastavrita, Ayurveda College, Coimbatore, to deliver the vote of thanks.
Thank you. Am I audible?
Yes, ma'am, you're audible.
Okay. Good evening, all. On behalf of Ayurveda College, Coimbatore and DIKSHA E-Learning platform, I extend my deep and sincere gratitude to Dr. Kamlesh Shivaram Mahajan, sir, for accepting our invitation and delivering such a wonderful lecture to all of us. And cardiac rehabilitation, the topic which sir has selected for this today's webinar also, it's gaining wide popularity now because we are losing our young generation because of cardiac ailments. Many examples are there recently also. So this topic, the knowledge what sir has shared, I hope it will be definitely useful for all the practitioners, all the listeners, the students, especially the also the students as well as practitioners also in their career as well. And I thank all the participants also for making this session lively as well as interactive. Thank you all. Thank you, sir, once again. Thank you, Diksha, and thank you, Dr. Sudhiraj Memorial Webinar Series for making this wonderful session. Thank you, sir. Thank you.
Thank you once again.
Thank you, sir. Thank you so much.
Thank you, ma'am. It's the province of knowledge to speak, and it's the privilege of wisdom to listen. Thank you all for patiently listening and spending your valuable time. To know more about our updates, please do stay connected with our social media platforms. That's all for today's most interesting session with lots of of new information for us to close our eyes with thought-provoking knowledge. Thank you all for joining us. Thank you.
Can I do, madam?
Pardon, sir?
Am I due now?
Yes, sir.
Okay, thank you.